Coming up, we'll be on location at Bathurst Family Therapy in Woodstock, Maryland, discussing the benefits of relationship therapy and how it can effectively help improve your life, relationships, career, and overall well-being with one of this region's top doctors, Dr. Stephanie Bathurst. Welcome, Dr. Bathurst. It's a pleasure having you on our program today.
Thank you. It's a pleasure to be here.
Oh, it's your first time, in fact, on with us. We have a lot to talk about. You're certainly recognized, Dr. Bathurst, as a top doctor as well as a top relationship therapist throughout the DMV region, and have established a reputation for excellence in helping your patients successfully overcome the many challenges that can adversely affect relationships. And I wanted to begin, if I may, by please having you tell us about your vision for your practice, Bathurst Family Therapy, and what you feel helps separate you apart from many other mental health practices in the region.
So the vision for my practice is to heal people who have been negatively impacted by relationships in the past, to empower relationships moving forward, to maximize sexual fulfillment for clients across the globe. Something that I feel separates me from other colleagues in my field is that I work really heavily in the polyamorous and consensual non-monogamy community. I am trained in 4 different health fields, which I integrate in every single session with my clients. So I am a licensed clinical marriage and family therapist. I'm a board-certified clinical sexologist. I'm a certified integrative medicine specialist for mental health, and I have multiple certifications and trainings in somatic healing approaches, including Pilates, which is a evidence-based pelvic floor stabilization program, as well as EFT, which is an acupressure tapping approach for regulation of the vagus nerve.
Yes, you actually have quite a bit of expertise, multiple complementary modalities and integrative modalities, utilizing that approach to really customize the appropriate plan to help each of your patients and the couples and the relationships that you help so many folks with, right?
I think you summarized that very nicely.
Oh,
yes.
Thank you. I'm a host that listens, Dr.
You are,
Bathurst.
yes.
And what would you say, Dr. Bathurst, are some of the more common issues that you see in your patients and clients?
Certainly communication, and that's a very large umbrella. So some of the smaller subsects of communication that I see very commonly is miscommunication, lack of communication, and toxic communication, which very commonly presents as the 4 horsemen from Gottman methodology. So defensiveness, criticism, contempt, and stonewalling. In terms of other more common issues, we also have navigating consensual non-monogamy, loss in any one or more of the 8 forms of intimacy. And the 8 forms of intimacy are physical, psychological, sexual, social, experiential, emotional, intellectual, and creative.
Okay.
And probably holistic healing in a variety of mental health difficulties like anxiety, depression, various addictions, ADHD.
And what would you say, Dr. Bathurst, are the reasons or the causes for some of these issues you just mentioned?
That is a great question. So for communication difficulties in relationships, oftentimes that boils down into defense mechanisms. So usually that is somebody's brain recognizing a threat, a personal threat, meaning your brain is calling out a potential pain moment, and self-protective mechanisms are on setting. So we're needing to recognize that as the underlying function of these communication barriers in the relationship, and that requires attention.
Yes.
for some of the intimacy blockages, that is caused by rigidity or inflexibility. In relationship dynamics, if we are not adaptive, if our relationships are not changing and evolving with us, we as human beings are constantly changing, we're constantly growing, we're constantly evolving. That's just part of life. That's part of developmental nature, right?
That's right.
Because of that, our relationships have to be constantly evolving, or else they're old and they're dysfunctional, right? So oftentimes the rigidity of our relationships are what's causing a loss of intimacy.
You're absolutely right. As we evolve, right, personally through life and life's journeys, we have to make sure we continually evolve in all aspects of our personal lives, not just from our mind, body, soul perspective. And that, i.e., means in our relationships, we need to evolve as well.
Yes, yeah, and that our relationship has not stagnated.
That's right.
It hasn't become complacent. We haven't
Exactly.
gotten bored, or it hasn't gotten old, right?
Yes,
We're constantly giving energy to it.
Absolutely, Dr. Bathurst.
Yeah. Oftentimes when we see infidelity or other sources of betrayal present in a relationship, it is frequently correlated with periods or episodes in a relationship that are very difficult or tension building. So these would be developmental periods like having children, or the marital slump, which statistically is around years 7 and 8 in the marriage. Usually that's when divorce is of highest probability. Or when developmentally in the later 20s or early 30s, when the individuals have grown but in separate paths, that can be distancing for the relationship because they haven't grown together. So these would be moments within the relationship that would aid to deprioritization and place stress on the system and enhance opportunistic intimacy loss or infidelity. So that would be a source or a cause for moments of betrayal.
Yes.
And then in regards to potential reasoning for mental health difficulties, nutritional or mineral deficiencies, bodily inflammation, environmental chemicals, negative thinking, these are all potential sources of chronic mood disruption.
Now, what kind of impact can these causes that you just stated, Dr. Bathurst, have on relationships? And I know you just touched on that briefly, but if you could be kind enough just to elaborate a little bit more on that for us.
Sure. So evolutionarily, we all have an ingrained sense of belonging, right? We all have this inherent within our DNA, this is a cellular drive, this inherent sense and desire to connect with a significant other, with an attachment figure.
Yeah.
So when we feel something threaten our sense of safety, security, stability with said attachment figure, and when we're adults, that attachment figure is no longer our parent, as when we're a child, it's our significant other, it's our partner, right?
That's right.
When we feel that threat, which would be any of the previously stated presenting problems that we just reviewed, any of them would be potential threats to us.
Yes.
Our brain doesn't really differentiate, right? A threat is a threat, a pain moment or a potential pain moment is just that. There is no discernment there.
That's right.
The impact can be incredibly dire. So I would say the impact is pretty severe.
Yes, yes, indeed. Well stated. And as far as what is the patient evaluation process for diagnosing these issues, and for instance, when a potential patient or client initially contacts you, for the folks out there watching, can you be kind enough just to take a moment to tell us what the process they initially go through with you?
So in the beginning, a new client can contact me in a number of ways. They can contact me online through my website. They can contact me over the phone. I offer free consultations. And I'm very transparent, so we can go through, and I'm also fairly informal. So we'll go through all of the treatment options and we'll see if we are a good clinical fit. Not everybody is going to be the best fit for me and vice versa. So that's the whole point of the consultation.
Just to see if it is something that you were able to help that particular individual or individuals if it's a couple, for example, right?
Exactly.
And like you said, vice versa, if it's a good fit for them with you as well.
I want everybody to get the exact support that they are needing and they're looking for. So that's the whole purpose of the consultation.
I understand. That makes perfect sense. It
Yeah.
is, after all, if you may use that term, a partnership with you helping each of your clients and patients and them working with you. They have to be willing to take that next step as well, right? To go through the customized therapy option, for example, that you all decide on, that you feel with your expertise would be beneficial in helping that particular patient or patients.
Absolutely. Yeah. It's the first step to us building that alliance, that rapport, and our trusting relationship. So it really is a critical step. So we will go through all of the treatment options and evaluate what is the best fit. And usually it's a mix, it's an integrative approach with what they're looking for and what they're wanting to attend to.
Well, you have a number of tools in your toolbox, if I
That
may
is
use
true.
that term, in mental health, with your expertise, as we touched on earlier in this interview, multiple complementary modalities, and the fact, as you just mentioned again, utilizing all that in an integrative approach and customized approach, as well as a holistic approach to really help each of your patients and clients.
Thank you. Yes. So we work together, again, collaboratively. I don't just receive their intake form, look at the paper, and then give them an evaluation or a test and send them away. I don't believe that the test results are the end result or the end of our process.
Yes.
I believe that an evaluation or an assessment should guide us as to the direction of where our work should be.
Yes.
It should not be the completion of our work.
Yes, indeed. I love that approach in helping your patients and clients, Dr. Bathurst. So well said again.
Thank you.
You're welcome. And if you could also be kind enough to take a few moments to tell us about some of the effective strategies or therapies that are available to help address some of these issues with your patients and clients.
Of course. There's a lot that we can do in regards to communication reform. So I'm just going to shout out a really applicable and easy option for communication reform. So what I recommend is grounding with three things if you're going to start a new conversation in a partnership. So first is maintain eye contact. So initiate eye contact with your partner. This does one of two things. One, it ensures that you have one another's undivided attention, which is really critical because you don't want to be distracted. It leads opportunity for miscommunication, which increases conflict.
Yes. Goes back to that top issue you mentioned, the
exactly.
communication problem.
Absolutely.
And then what would be the number 2 area there?
So the number 2 reason for eye contact is that it gives you an opportunity for a little boost or flood of oxytocin, which is the bonding hormone.
Oh, okay.
So it has a little positive effect, which increases the probability of having a more positive and successful experience or conversation.
Makes perfect sense.
So 1 is eye contact. 2 is to, it's a newspaper headliner is essentially what I say.
Okay.
clearly verbally articulate what it is that you are talking about. Okay. And I know that sounds really silly and simple, and it is, but it's very, very common that I will have a couple sit down on my couch, and 10 minutes into an argument, I ask them what they're talking about, and they give me two very different answers because they haven't actually clarified with one another the specific content of the argument. So be very specific and articulate what it is that you're talking about before you engage in the conversation. So give a newspaper headliner is the second one.
Okay.
And the third grounder before you even engage in the conversation is a cohesive goal.
Okay.
So what this does is ensure that you are on one another's side, right? We want for there to be a complete diffusion of any power dynamic in the conversation.
Yes.
If that starts to pop up, if you feel or your partner feels at any point in the dialogue like it's you against one another, right? Or that there's a hierarchy forming, one of you or both of you can shout out the cohesive goal that is bonding, and that power dynamic just kind of floods away. Okay?
Very interesting.
So those are the three grounding or anchoring forces that you can exchange to make sure that the conversation goes well before you even engage in it.
Great points. I love it. Eye contact, the newspaper headliner being number two, and then, of course, the cohesive goal, as you just wrapped up that last answer with. It really makes total sense as you explain it to us so we can all understand, right?
Absolutely.
I know it depends on each particular patient or client's and his or her commitment as well. It's like a two-way street, right? Between you, the doctor, and your patients and clients, each taking that step together, each step of the way through the process to help them achieve their goals. But typically speaking, and again, I know it can vary, but generally, what type of results can your patients and clients expect? And what are they seeing?
When it comes to contracting a different relationship style, so frequently for consensual non-monogamy, when there is a coupledom who is coming to me starting with monogamy and transitioning into more of an open style relationship or a polyamorous relationship, that requires very intentional mediation on my part to negotiate and communicate effectively and healthily that transition. And that has to be, that's a very refined and purposeful transition. It has to be, there's a degree of finesse that has to happen there.
I can imagine.
Yes, yeah. So what I'd like to say is that in regards to that, it's not so different from all other relationships that have a degree of contracting. Every relationship has a contract to it. If your relationship doesn't have a verbal known contract, it just means that more than likely you have multiple contracts that are operating at a simultaneous capacity, which is more than likely why there is miscommunication and higher probabilities of conflict.
Yes.
So I empower everybody to grab your partner and partners and have a consensual and free-flowing conversation about what your relationship contract is.
Yes.
And hopefully you can have a really productive conversation where you can have the development of one singular contract with all of your partners.
Yes, indeed. It goes right back to communication, right, Dr. Bathurst?
Absolutely. Everything does.
Yes, and that way we're all on the same page
Yes.
and less likely to have these conflicts.
Absolutely. Yes.
Now, I also wanted to ask you, and I know the answer to this next question certainly depends on each patient, each client. Everyone's different. Where no two people are exactly alike. But generally speaking, what type of results are your patients and clients seeing from your therapies and all your expertise and your services that you help them with?
As long as every partner involved is 100% invested in the process, is able to attend each session in the degree of frequency that I recommend, meaning we are building off of each session, not having to restart with a summary of what has happened in between because we have gone too long.
Sure.
And they are completing the exercises that I give because I give activities and resources and self-reflection worksheets after every session that I have with each of my clients. So there's work being done after each session. So as long as all of that is happening,
Yes.
results are pretty repetitively dramatic and rapid.
That's certainly good to know and
Yes.
great to hear.
Yes.
All right, because there's a lot of folks out there watching that can certainly benefit from all that you bring to help individuals and couples out there.
Thank you. I always say to my clients that I have so much respect for them and what they do in our process because I feel like I have the easier job. Of course, I love what I do, which is why I do it.
Yes.
But I feel like I have the easier job because I get to bring the information and the activities. They have to go home and do the hard job of creating the change and being uncomfortable with that change process, which goes against our very nature as human beings, right?
We're creatures of habit.
Exactly.
And
exactly.
to undo some of those habits that we need to correct or eliminate in some cases, right?
Absolutely.
To further ourselves, to grow, to enhance our relationships in life and through our journeys in life, we have to be willing to make changes when needed.
To be uncomfortable.
Yes.
Yes.
That is such a key word right there, uncomfortable. And that is needed. And a lot of folks aren't willing, they think they're willing to do that, but then as they start going through the process, they start getting uneasy, which is natural, right?
Yep, we have to normalize that and embrace it
Yes.
and be willing to tolerate it for the betterment of our future selves.
That's right. That's absolutely right. Now, I know the number of sessions certainly would depend on the therapy or the treatment plan that you've outlined to help each of your patients and clients. But typically speaking in this area as well, what would you say, how many sessions, for example, would you recommend initially to your patients and clients?
For something that is much more logistics based, like relational contracting, where every partner or every party that is present is already aware of their needs and limitations going into the sessions, it can easily be a 2-session experience from start to end. So very, very rapid, very quick, very easy. For something more emotionally focused and more complex cases, such as trauma reprocessing, that can be much more intensive and more around the range of 6 months.
Okay. And that, again, totally understandable because if it's something more of a simple nature, then I can see why it would only take a couple of sessions or so.
Sure.
But if it's something more complex, much more involved, then that also makes sense that it would take some time. And that time is really nothing in the big picture of things because obviously you're helping us undo issues that we've had for many years and we need to obviously correct to enhance and have effective and successful relationships in our lives.
Absolutely. And despite the range, because again, it is highly variable, every modality that I implement, because again, in the consultation and in the initial sessions with every client, I am going to go through whatever integrative approach is best fitting.
Yes.
I only implement evidence-based practices. So we will go through known techniques that are efficacious, right?
Yes.
These are not going to be modalities that are ineffective and a waste of time.
Of course. Of course.
These are things that have scales of measurability so that we have ways of, with a high degree of frequency, evaluating progress, stagnancy, or regression throughout the process so that we
Yes.
know, is this working or is this not? Do we need to switch gears?
Yes, evidence-based, measurables, customized, as you said, proven and effective,
Yes.
and then utilizing your integrative approach to bring it all home for
Yes.
each of your patients and clients. And like with everything else, when we take a step forward, for example, your patients, clients, they benefit greatly from your therapy and your sessions. The results are there moving forward, but can they be permanent as well? Or, and I would imagine, to keep them as close to permanent, they would need the occasional tune-up, if I may use that word, right? To check back with you just to see how they're progressing and how they're holding.
Absolutely, the results can be permanent. So we aim for continuity at home, which is specifically why I give exercises at the end of every session. My role in their lives is meant to be temporary. Their change processes are meant to be permanent. Now, depending on the presenting issue, there are some manifestations, there are some presenting issues that do have a higher degree of recurrence and do require more maintenance, sometimes therapeutically mediated. And in those particular presentations, I do have clients who prefer to meet with me every couple of months or on an as-needed basis.
Okay.
And that's absolutely welcomed. My clients, even from 10 years ago, know that they can contact me anytime. It is an open door policy. Even if I haven't been contacted in a couple of years,
Yes.
always,
You're always there for each of them.
always, always.
And that's another major benefit of the approach you utilize, and a lot about you as a doctor. And you're right, because there is a risk of regression, right? And that's where you're right there to help them when that comes up.
Yeah, we have that relationship already, and I care very deeply for them as human beings and as
Yes.
previous clients, and I want the very best for them.
Yes.
And so if they need anything moving forward, then of course I want them to reach out to me.
Yes, indeed. Now, we're literally out of time, Dr. Bathurst, but I just wanted to ask you in this interview if you could be kind enough just to take a few moments and tell us about some other types of therapies that you also offer and have expertise in at your practice. And I know you touched on some of these in the very beginning of this interview when you talked about your areas of expertise, but if you could just be kind enough to elaborate a little bit more for the viewers.
Of course. So I'm a certified life coach as well.
Now, there's a wonderful modality to
Yes.
complement your other modalities in mental health.
Yes, so it focuses a lot on empowerment and providing clients lifestyle freedoms. It offers me providing client services globally, so it's
Yes.
really wonderful. I provide integrative medicine, so herbal supplementation, specifically adaptogenic and nervine
Yes.
supplements.
On the life coaching side, that is a wonderful area of expertise for you,
Yeah.
another tool in your toolbox
Yes.
to help your clients and patients, for the simple fact that so many of us need that coach in our lives to help us through our journeys in life, because it's easy to kind of go off to the right or left a little bit on the path that we're on, if not fall off that path. And
Yeah.
that's where a life coach comes in as well. That's wonderful that you also offer that.
Yeah.
And as far as the integrative medicine, you were just telling us a little bit about that. Can you elaborate a little bit more on that modality as well?
Yeah, absolutely. So there are a lot of alternative medicines, or so this includes herbal supplementation. This includes light therapies.
Yes.
This includes meditative movement forms like Tai Chi or transcendental meditations. This includes auditory therapies like binaural beats.
You're kind of combining some of the best from the East with the West in
Exactly.
helping them when you just gave some of those examples.
Conjunctive, right?
Yes.
To mesh together, we get the best of both worlds.
Yes,
truly.
indeed.
If anybody wants to find me online, they can find me at bathurstfamilytherapy.com, and I also offer a free relationship flow quiz. You can find your personality type online by taking my quiz at myflowtypes.com. Yeah.
Well, that's wonderful. And on that note, I'd like to thank you, Dr. Bathurst, for joining us, educating us, and enlightening us, and being a guest on our program. It was certainly a great pleasure having you on with us today.
Thank you so much.